In this second module, we turn our attention to the intersection of climate change and health, and the policies needed to protect populations. Climate change is already recognized as the greatest public health challenge of the 21st century. It increases disease risks, weakens health systems, and deepens social inequities. We will discuss these impacts and consider how economic principles guide effective health policies. Section 1: Climate Change and Human Health Risks. Climate change affects human health in multiple ways. Heat stress, rising temperatures increase the risk of heat stroke and cardiovascular diseases. Vector-borne diseases, warmer and wetter climates expand the range of mosquitoes, spreading malaria, dengue, and Zika. Waterborne diseases, flooding and poor sanitation spread cholera and other diarrheal diseases. Air quality, increased wildfires and pollution worsen respiratory illnesses like asthma. Nutrition, crop failures and rising food prices worsen malnutrition. Mental health, communities displaced by disasters face trauma, stress, and depression. These health impacts impose economic costs in the form of hospital care, reduced productivity, and lost income. Section 2: Health Systems and Vulnerability. The vulnerability of populations depends on the strength of their health systems. Wealthy countries can invest in cooling centers, early warning systems, and resilient hospitals. Poorer nations often struggle to provide even basic care. Economic resources therefore determine whether communities can adapt to climate-related health risks. Policies must prioritize equity, ensuring that vulnerable populations are not left behind. Section 3: Policy responses to climate health challenges. Health policies addressing climate change can take many forms. Preparedness and resilience, strengthening hospitals, training health workers, and stockpiling essential medicines. Surveillance systems, monitoring disease outbreaks linked to climate conditions. Preventive measures, vaccination campaigns, mosquito control, and clean water initiatives. Infrastructure planning, designing health facilities that withstand floods, storms, and heat waves. Each of these requires financial investment and careful economic planning. Section 4: Integrating economics into health policy. Economics helps policymakers prioritize limited resources. For example, cost-effectiveness analysis determines which interventions save the most lives for the least cost. Health impact assessments evaluate the benefits of climate policies, such as cleaner air from reduced emissions. Insurance schemes and social safety nets reduce the financial burden of climate-related illness on households. By integrating economics into health policy, governments can ensure that climate adaptation measures are both affordable and effective. Section 5: Global Governance and Policy Frameworks. Climate and health challenges do not respect national borders. International institutions like the World Health Organization, United Nations, and World Bank are central to setting agendas and financing action. The Paris Agreement recognizes health as a co-benefit of climate action. The Sustainable Development Goals link climate, health, and economic well-being. Global funding mechanisms, such as the Green Climate Fund, support low-income countries in building climate-resilient health systems. The success of these frameworks depends on political will, financial commitment, and collaboration across countries. Section 6: Towards Sustainable Futures. Looking ahead, effective climate and health policy requires a systems approach. This means recognizing the interconnections between environment, economy, and health. For example, investing in renewable energy not only reduces emissions but also improves air quality, reducing health costs. Promoting sustainable agriculture not only protects the environment but also secures food and nutrition. Designing climate-smart cities with green spaces improves mental health, reduces heat, and encourages physical activity. Policies must be holistic, long-term, and inclusive, ensuring that future generations inherit a livable planet and resilient societies. End of Module 2 Summary. In this module, we examine the health risks of climate change, from heat stress to disease spread, and the vulnerabilities of health systems. We explored policy responses, the role of economics in health decision-making, and the importance of global governance. We concluded by emphasizing integrated, sustainable strategies for the future. This course, Climate, Economics, and Health Policy, has shown us how deeply climate change is interwoven with economic systems and human well-being. In Module 1, we focused on the economics of climate change, its impacts, inequalities, adaptation and mitigation strategies, and the role of international cooperation. In Module 2, we turned to the health dimension, how climate affects disease, health systems, and global governance, and how policies can protect communities. The key takeaway is that climate change is not a distant environmental issue. It is an immediate challenge that requires integrated economic, health, and policy responses. Future leaders and professionals must think across disciplines, designing solutions that balance environmental sustainability, economic efficiency, and human health.